Hello everyone, welcome back to our channels. I am Dr. Ihssan and today we are going to talk about CPV or Canine Parvovirus. CPV is a highly contagious and potentially fatal viral illness. It primarily attacks the gastrointestinal tract and can also damage the immune system by causing a drop in white blood cell count. So what is the cause of this disease? CPV is an undeveloped single-stranded DNA virus believed to have arisen from Leukopenia virus. Well then, how does the disease develop? Replication occurs essentially in the lymphoid tissue of the oropharynx, with subsequent dissemination through the blood. CPV destroys rapidly dividing cells of the small intestinal crypt epithelium, lymphopoietic tissue, and bone marrow. Destruction of the intestinal crypt results in epithelial necrosis, villus atrophy, and disrupted gut barrier function. Lymphopenia and neutropenia develop due to destruction of hematopoietic progenitor cells in the bone marrow. So, after we know the cause, let's see how the infection is transmitted. Infection is acquired through direct oral or nasal contact with infected feces or contaminated objects. Like young, 6 weeks, 6 months old, unvaccinated dogs are most susceptible. Breeds at increased risk include Rottweilers, Doberman Pinschers, German Shepherd, and Pit Bull. And we don't forget, stress, concurrent intestinal parasites, and other enteric pathogens increase the severity of clinical illness. So what is the clinical signs? Generally develop within 5 to 7 days after infection. Initial signs include lethargy, anorexia, and fever, progressing to vomiting and hemorrhagic diarrhea within 24 to 28 hours. Severely affected animals may show signs of septic shock, such as hypothermia and pupils equality. So how can I get an accurate diagnosis? Diagnosis is typically confirmed via rapid fecal swab test, ELISA snap test. Additionally, a complete blood count (CBC) is often performed to check for low white blood cell levels, a hallmark of the disease. After all of that, what is a treatment protocol? There is no specific drug to kill the virus. Treatment focuses on supportive care. First, IV fluids to combat severe dehydration. Second, antibiotics to prevent secondary bacterial infection. Third, anti-nausea medication to stop vomiting and fluid loss. Finally, nutritional support through IV or feeding tubes if necessary. Last but not least, vaccination is the only effective prevention. So puppies should start vaccines at 6 to 8 weeks old, with boosters every 3 to 4 weeks until 16 weeks of age. Contaminated areas should be disinfected using a diluted bleach solution. Thanks for watching, and special thanks to the support of this presentation, Dr. Ahmed Skaf. See you in a new disease for pets. Salam.